So much. Thank you so much. Let's hear it for Hansori Pumandu.
Interview. Aye.
Division? Victoria?
No.
They came all the way from UC Irvine. Thank you so much. We'll see you at the middle. Okay. Vivian? Adjust the microphone.
Hello everyone. My name is Vivian Matsushiye, and on behalf of Progressive Asian Network for Action and the Neighborhood Safety Companions, I would like to welcome you to today's forum. I hope that at the end of this afternoon, this program will raise your awareness about healthcare justice for all, including culturally sensitive bilingual and bicultural services for ethnic communities. We hope that this awareness encourages you to support health care for all in California, particularly the California Assembly Bill 1400, or known as Guaranteed Health Care for All. This will also, we hope that this will also prompt you to take some form of action by sharing what you have learned with friends and, importantly, with your state representatives, and ask them to support this bill. Just a few minutes before we start on housekeeping matters, the restrooms are through this doorway to the right for men and women both. And we would like to encourage you to please partake of the refreshments we have at any time. I would like to introduce to you now David Monkawa, who would be our MC.
Thank you so much, Vivian. Thank you, everybody, for coming here. Let's give yourselves a little applause here for getting over here. Thank you so much on a beautiful Saturday. We have great speakers here, and the purpose of why we're here is so that we all start understanding better what AB 1400, it's a great law, and how we can all get free bilingual quality health care at no cost. That's why we're here. And we're going to hear great stories from our communities as to why we need it so much as Asian American and Pacific Islander people here today. And right before I get to our first speakers, I just want to remind people, about 100 years ago, we used to have a Spanish pandemic here in Los Angeles, okay? All over the United States. About 1 million people died, from what I read. Right here in downtown Los Angeles, they have vaccination, mass vaccination. And back then I was reading, if you don't have a mask, you go to jail automatically, 1918. So many people of us died, people of color, because we didn't get vaccination. We didn't get health care. It was all segregated. They had hospitals for whites and hospitals for other people back then. Not just in the South, but here too. But a lot of that, we made progress, because thanks to the civil rights movement in the 1960s, we got Medicare, right? We got Medicare, and everybody can get health care if you're 65 and older. Not so good for the rest of us. But that's what we're here to address today, partially. In California, 3.2 million people have no health care. 3.2 million people. About 10 people today will die in California because they have no health care. Disproportionately, people of color. So in the past, we've had to do things like raise money, mutual aid, raise money to get clinics like Cairo, and in the Latino community and the African American community, midwives really helped a lot to give us health care. Midwives and clinics that we had to do on our own. And today, we have something that'll help us catch up a lot more.